So, ladies and gentlemen, my name is Sharon Whiteman. I'm the CEO at the Lyme Disease Association of Australia, and we've been doing a series called Australian Lyme, A Global View. Things are pretty dire in Australia right now, and we really wanted to give an international perspective on the entrenched situation that Australian patients are experiencing. And today, I'm very, very privileged to have Jenna Luche Thayer. She said yes immediately. We've interviewed, I think it's been a couple years ago, we interviewed her as well for one of our blog posts, and she's a global force to be reckoned with for all of us Lyme patients. Now, just to give you a little bit about her background, Jenna Luche Thayer, MIA, founder and director, Ad Hoc Committee for Health Equity in ICD-11 Borreliosis codes. She is a former senior advisor to the US government and the United Nations, and is currently assisting institutions and communities to build a humane and rights-based patient-centered response to the global borreliosis pandemic. Luche Thayer has 35 years of policy and grassroots experience in 45 countries and works across the globe to help institutions remedy entrenched practices of discrimination that interfere with their higher purpose. Her expertise includes government transparency, accountability, human rights, and political representation of marginalized groups. The Ad Hoc Committee executed a comprehensive approach that helped to successfully establish new codes for Lyme, including life-threatening complications. The revised codes now include congenital Lyme borreliosis and dementia and central nervous system demyelination due to Lyme borreliosis. This is the first time in over 25 years that these serious complications have been officially recognized by the World Health Organization. Luche Thayer has worked with governments, the United Nations, nonprofits, corporate world, and has over 75 publications. Her awards include International Women's Day Award for exemplary dedication and contributions to improving the political and legal status of women from the US government, highest ranking technical area in accomplishment, innovation, and comparative advantage for United Nations Capital Development Fund, the International Lyme Associated Diseases Society Power of Lyme Award. Wow, those are amazing credentials, and a heartfelt thank you because it does filter through to Australia, the work that you do.
Thank you.
So Jenna, let's start from the beginning. How did you get involved with championing this big issue of global Lyme disease?
I would like to answer that question, but first I just want to put out a small correction that when you introduced me, you talked about congenital Lyme now having a code. Mm-hmm. I'm going to get into the story behind that. It was given a code and then the code was taken away.
Oh, okay.
So we'll come back to that, but I wanted to mention that. It doesn't mean that it cannot be coded, be attributed, but it's different than having a primary code.
Okay.
Anyway, so how did I get into this? Well, my credentials talk about government transparency and accountability. The flip side of transparency and accountability is corruption. So, in fact, a lot of my work has been on corruption issues in both the government sector as well as the globalized private sector, multinationals, and how they affect policy and implementation of all kinds of services that are rightfully due to citizens across the world. Anyway, so I'm coming at this. What happened is I was becoming increasingly ill. I was going to multiple doctors, not knowing exactly what was wrong with me, being told I had many different diseases. I was told I had multiple sclerosis. I was told I had lupus. I was told I had 4 other autoimmune diseases. I was told I couldn't handle stress. I was told that maybe I had some unresolved issues. And a whole bunch of hogwash. Oh, and I was told that women often have issues.
How many times do we hear this again?
I'm laughing about this, but I mean, I think from the age of 16 forward, a doctor would say it's probably something to do with your your femaleness. Mm. Anyway, I'm laughing about it, but in fact, it's not funny. I was getting very, very, very ill to the point where I had to leave my full-time job because I just could not manage it anymore. So here I'm 40 years old. I've left a very high level position at the United Nations. I'm unable to, I was traveling 70% of the time and I couldn't cope physically with it. So I decided to work consulting instead of working full time. And I was able to do that for a number of years, but my health continued to deteriorate. It wasn't until I was 52 that I was diagnosed. So well over a decade looking for answers as to what was causing my health problems. And when I did finally find out that I had Lyme disease, I started researching it because I'm, very interested in all such matters of service in terms of health service, access to healthcare, et cetera, because I worked across the globe on basically helping get basic services to marginalized groups, and healthcare is a big part of that, my professional work. So I started looking into it and I said, I think I know what's going on here. We have massive corruption and human rights abuse. And this explains a lot of what is experienced globally by the Lyme patient community. And I'm using the term Lyme, but I'm also including people with relapsing fever borreliosis, other pathogenic forms of borreliosis, and tick-borne co-infections that often are bundled with this infection. And I myself have relapsing fever borreliosis, as well as Lyme borreliosis, as well as other tick-borne diseases. I was born in Asia. I grew up in Asia and Africa in rural communities, farming communities, and have had multiple tick attachments my whole life. Probably got infected when I was 16 because that's when I had a facial palsy that was associated with 3 months of severe fatigue and joint pain and fevers, spiking fevers that would come and go. So I can't confirm it for sure, but I've had it for a long time. And like so many people, it would kind of come and go, and I would go through periods of wellness and then have periods of odd health issues or debilitating health issues, and then they would seem to resolve, and then I would continue and all. And, quite a productive life despite having carried this infection untreated for such a long time. Anyway, so when I realized that I had joined millions of other marginalized patients across the globe, I said, this is very ironic and tragic that, first of all, there's a disease that's not being treated, that there are millions of people across the globe that are being denied medical care, that it's based on corruption, and it's fomenting huge aggressive amounts of human rights abuse. And given that I worked to recognize human rights abuse and get them recognized, I worked to make sure that services were provided to marginalized groups, and I worked to make sure that marginalized groups had a voice in the process of care and access to representation, as well as access to services. I felt that I could bring my professional skill set to do something about this pandemic. So, however, I really wasn't sure where to begin on it because it's so big and it's so vast, and it's very well coordinated on a global scale. The corruption is very well coordinated. The denial of the epidemic is very well coordinated. There are many different reasons driving the corruption, many different actors benefiting from the corruption. It's not like it was masterminded. It's just that it's been kind of opportunistic, predatory behavior on the part of many different groups. So from the health insurance industry to the pharmaceutical industry to national health services. All of these groups are benefiting in different ways from denying the nature of the disease. And this is very well documented by Pamela Weintraub in her book called Cure Unknown, where she provides, evidence of the memos that began in the 90s in the United States, where the insurance companies took a decision to just stop covering treatment for Lyme disease. Mm-hmm. And since then, of course, there's a Texas lawsuit in the United States, which is naming multiple members of the Infectious Diseases Society of America who are complicit in denying access to medical care through the insurance networks. And I bring this up because it's so critical that we understand that it's being done in a very globalized manner. So you have the US working to deny care, but the same approach for denial of care has been adopted by national health systems. And many of the insurance networks that we talk about that are in the United States are actually multinational insurance systems. For example, people don't know that in Holland, they have a national health system, but it's being managed by private insurers. Okay. So private insurers are actually determining whether or not you will have access to treatment in Holland, even though you're paying into a national health system and you think you're getting national health care directly from the government. These are intermediaries. So I was unraveling this whole situation and trying to get a grip on what was happening, why it was happening, how it was happening. And then I felt very challenged on what could I possibly do? It's so big. The problem is so big. And I was fortunate enough to meet Dr. Ken Legner, at an ILADS conference. And we became friendly and we started talking to each other quite a bit. And he mentioned to me that there are these medical codes that are very frustrating because they do not specify the complexity of the illness. They're very limited. And without these medical codes, then you have no way to link it in the US system to insurance coverage or Medicare and Medicaid and national health insurance coverage. So without a medical code, you basically have no way to link a medical condition to reimbursement of care or coverage of care. Mm-hmm. Now, what people don't understand, many people, is that these medical codes are developed globally by the World Health Organization with the participation of over 190 countries. And there's only 196 in the world. So almost every country in the world is involved in developing these medical codes. And then they are used by every country in the world for reasons of coherence. So for example, if there was a pandemic of some kind, like a bird flu influenza, there would be a medical code for that. And any medical doctor, physician, practitioner in the world could look it up, and they would get a description of the illness, the basic symptoms, and information on how to go about handling it. So it's very important to have kind of globalized medical codes. So when he was talking about this, the medical codes being so limited, I realized that here was the opportunity to use my skill set to make a difference, because I understand the United Nations system, and the World Health Organization is part of the UN system. I know how to form effective international committees. I've worked expediently across many different political systems. I just have the skill set to bring together something on a global scale that could hopefully help affect a global change. And so working with him, we identified many, many different people across the globe who could join the ad hoc committee. You're frozen right now. Okay, yeah. Anyway, we identified many different people across the globe that could join the ad hoc committee. So this was where I felt the entry point was for me to come in, not as a medical specialist, but as somebody who understands international systems, international bureaucracy, and how these kinds of processes are done. Plus, I knew, given what I read, that presenting the science and medical information about Lyme had not worked, had been insufficient to make change. And so I decided in this case not only would we present the medical and scientific information about the disease to change the medical codes, but I would catalog all the related human rights abuses due to the insufficient codes. Mm. And even if people don't understand all the medical, or they are confused or put off by the controversy on the debate, medical and scientific debate, they do understand human rights issues and human rights abuses, because these have been globally unified across the world, and there are 31 very specific human rights articles that are being adhered to. So that was really the entry point on where I felt that I could come in and, you know, start to make a change. So that is, I think, the first question. Is going into the next series of questions as well.
Yeah, so that's the, you know, overwhelming blocks that you could witness and then find a way in. What keeps you going through the, you know, well, using your words, that abject corruption that's happening globally? It's very, well, it seems very smooth and orchestrated these days.
Well, you know, I've been working on human rights for decades. And there are always perpetrators of human rights abuse. Mm. And in many cases, they are supported by the state and the government. You know, these abuses happen because the government turns a blind eye to them, or they're complicit in them. So and yet you can see changes in progress. But it's kind of like, if you look at, you know, the forces of light and the forces of darkness, you know, there's corruption and there's greed, but then there are all these individuals across the globe who are trying to push back against it. And that's really why it's easy. I can go on, because I meet people when I start to feel like I'm banging my head against the wall and what the heck, you know, and this and that, I'll meet another person who inspires me, because they are continuing to make effort. And in many cases, it's these efforts that accumulate over time and space that make a difference. I mean, when it comes to, you know, what is it like to be a human being and what is one's rights as a human being, this has been an ongoing movement over a couple hundred years. Mm. And even something like the U.S. Constitution, you know, all men are created equal under the law. Well, when they wrote that, they didn't include women, and they didn't include people of color, you know. Yeah. And it was only pressure from the grassroots, bottom up, people demanding their rights, that language became more inclusive, and that understanding of what all men equal means, you know. So when you look at human history, you can see these periods of time where there's been, you know, significant advancements, and then you see like a backlash, then you see more advancement and a backlash, and right now, I mean, medical marginalization and medical corruption is one of the biggest global issues, because according to according to the United Nations, the Special Rapporteur for Health Human Rights did an assessment of how the global healthcare sector was faring, and comparing it to other sectors like tourism and fisheries and entertainment, mining. I mean, you name it, just every kind of economic sector, industrialized, tour, you know, retail, etc. And they found out of all the sectors, pretty much the global healthcare sector was the most corrupted.
Oh, okay.
So it's not just Lyme disease. I mean, it has tentacles of corruption going in many different directions. What's the most powerful sector in the world now? The most profitable? Insurance. You know, it used to be big oil. You know, now it's insurance. Insurance is the most profitable sector.
And it's big pharma. Yeah.
Pharma's in one of the top 3.
Mm.
And so you have pharma and insurance, and they're working together hand in glove to mutually benefit in many different ways. And then you have the healthcare sector. Everyone needs health. Everyone needs access to health care. It's so easy to exploit. It's not like a consumable good where, will I buy or not buy a sweater? I have 5, I'd like to have a 6th. No, healthcare, you need to buy it. You need to buy access to care. So it's more prone to being exploited because people need it.
Mm.
So the insurance industry has very systematically, legislated its corruption. You could say in some cases, well, that's legal. It's legal, but it's completely unethical and immoral. Many of the things that are being done. Pharmaceutical industry, again, completely unethical and completely immoral. I don't know if you heard the news, but, they had presentations before the U.S. Congress by a pharmaceutical company that makes Humira. And they asked the company, why do you have over 100 patents for Humira? Are there differences in these different patents? Are there like different forms of Humira? No, there's no different forms of Humira. They just found a way to get outside the loophole for pushing it into the generic market where it would be affordable.
Wow.
Is it legal? Yeah. Is it ethical? No. Mm. Is it denying medical care? Well, these kinds of practices basically do end up denying medical care for millions of people because it's become a hugely profitable industry. In the US, we have doctors that have incentives because they promote certain drugs. They're given incentives. Are the drugs good for you? Well, no, this is one reason why we have an opioid crisis, So I would say that Lyme disease is like the poster child for the corruption, but it's not the only example of this extreme form of corruption that we have. I mean, why was it that in the 1990s, the health insurance companies were allowed to just stop covering chronic Lyme disease? They decided not to cover it. And they just stopped covering it. And then they had got medical experts to come in and support their views that there's no such thing as chronic Lyme. Therefore, there's no need to provide treatment for it.
That's similar timing for the shutdown in Australia, really.
Yeah. So you have private insurers that do not want to pay for certain chronic conditions, not only Lyme disease. Until the Affordable Care Act was put in place in the United States, they were able to deny coverage for many other chronic diseases as well. So that law overturned that unethical practice. But Lyme disease, they've been able to continue to keep denying coverage of it. One of the reasons they're able to deny coverage of it is because the U.S. government does not want to have the liability of Lyme disease on its own rosters of employees. Okay. The U.S. government military does not want to cover the costs of all their soldiers who are exposed to the infection, all their military personnel, the people who work for the Department of Interior, who are going into the hinterland looking for extractable minerals, the parks and services persons, that are out in the grassy fields and forests, the Department of Transportation, all the people who are working on the roads to maintain them, and again, exposed to a lot of brush and forests and grassy areas. The Geological Survey, again, the U.S. government. So the U.S. government itself has a strong incentive not to recognize the devastating aspect of this illness because they would be liable for all of these employees, for the health care of all these employees. So it's to their benefit also to deny the disease. So you have private insurers who don't want to cover it. You have the U.S., powerful U.S. government that does not really want to cover it. I've collected an incredible amount of documentation. Back in the early 90s, the military was asked to do studies on how military families and military personnel were affected by the illness and it was considered a national security threat. Nothing happened. You know, a congressional inquiry and nothing happened. So, again, though, you know, you have more and more people in the military who are speaking out against it, you know, people who are in it, people who are just out of it, more and more government employees across the board who are starting to speak. I have recommended to the U.S. Lyme advocacy community to speak with the federal employee unions because they're very concerned about this illness. And as a federal union, they would actually have some power to negotiate attention to it and some change.
It's quite fractured thinking, isn't it, Jenna? Because the burden of disease leaving people sick, if you could assist them in recovery, they'd be back in their careers and contributing to societies, communities, and families. So it's very short thinking.
It is, except that if you can offload the cost onto the individual and the individual's family, then your fiscal year budget is kept safe. You know, you got to remember that governments work in annual fiscal years. That's their way they do their budgeting and thinking, and electoral cycles. So certain things you just want to kick the can down the road. You don't want to deal with it now if you can postpone it. Private sector, like insurance companies and pharmaceuticals, they're dealing on quarterly profits. So even though an insurance company might have massive savings by denying an illness up front, eventually there might be cost, but that's far down the way. And if they can split it into multiple different diseases, it doesn't show its impact.
So Jenna, what are your comments and thoughts on the prevalence globally? You know, currently, as we understand it, Australia is the only country to deny endemicity, which doesn't make, you know, all the speakers that we've interviewed on this series are outraged and incredulous, I guess is a good word. What are your thoughts on the global prevalence of Lyme and associated diseases?
Well, we know it's global. We know that pathogenic borreliosis exists on every continent, and almost every country has been proven to exist. I would nuance, you know, this concept of endemicity. Is it endemic? The U.S. claims it's not endemic in many parts of the country where it is endemic. So France does the same thing by the way it collects or does not collect and record infection. As Dr. Perrone was saying, Professor Perrone, they would only accept up to 5%. And after that, they wouldn't. So then they could not claim it's an endemic problem somewhere. So there's a lot of games on whether or not it's endemic. Australia has a harder line on that game, but it's the same way to deny the epidemic. You know, I don't know why they're doing it, but I think part of it is probably because of the burden on the national health system. Again, who's going to pay for it? Short-term thinking, you know, This budget year, this fiscal year. They're not thinking long-term, you know. And of course, then there's also the issue of all the biowarfare background with these infections. I mean, Chris Newby came out with a very good book called Bitten, and she's an investigative journalist, and she does very good documentation showing that there are multiple tick-borne diseases that have been messed with for purposes of biowarfare. Now, the U.S. stopped doing biowarfare experimentation back in the 70s, but they still do things to quote unquote be prepared in the event there's some pathogen is used. So there was weaponization of various pathogens as well as messing with the actual vector itself, ticks. So, the dispersion of tick bombs everywhere to see how disease might spread, what might happen, looking at tick species themselves and doing some work to make them, more hardy, able to endure more extreme conditions. So there's been tinkering with the diseases, and as with many situations, unintended consequences, they weren't thinking clearly, well enough about what would happen when these pathogens escape, because invariably, pathogens do escape because they're so tiny, and humans make mistakes all the time. My parents owned a home in Reston, Virginia. And at that time, there was this little concrete building near a swimming pool that all the kids went to. And one day there was everybody was told, don't go near that building. And then it was in the news that some people in that building died from Ebola. Okay. That was a little biowarfare laboratory right there in a little community outside of Washington, D.C. And they were experimenting with Ebola. And they had
strange world, isn't it?
Ebola infected monkeys right there. I was riding my bicycle every day, after school. I mean, so, I'm just saying that when you start messing with, these pathogens in and of themselves, pathogens are remarkably resistant. That's why they've been around for as long as they have. But when we start getting in as humans and start playing with them to see what might happen, there's a lot of unintended consequences. So, again, I think this also is one of the contributing reasons why there's been a reluctance to address the epidemic, because there's culpability involved in the spread of these illnesses. They may be naturally occurring, but like malaria is naturally occurring, but we have inadvertently weaponized malaria by providing multiple drugs that it's become resistant to.
Yeah. So this, so far we're talking the stuff of nightmares, really. You think that people have to counsel people after listening to this thinking of tick bombs, but what are the solutions, Jenna? What's the work that you've been doing?
Well, no, I mean, I think what's important is that, you have investigative journalists like, Chris Newby, who are forcing transparency on it. You have persons like myself who are connecting the dots and helping people to understand that their personal experience in Australia is really no different than the personal experience of somebody in Alabama or somebody in Switzerland, because these forces and these practices are being globalized. And I think the more people, we live in a different world today. We live in a globalized economy, and many things that are happening to people across the world are happening because of globalized forces and globalized entities. And we have to understand that. And we have to, in turn, be politically active in our governments and in the UN arena to bring about awareness and change to these matters. As long as we think it's a unique one-off situation, like this is happening only in Sweden, then we're being duped. We're being fooled. We have to understand that's not the case at all. So what I was going to say is, when you can step back and understand that there are many things put into place for this situation to be where it is today.
Same story spread globally, isn't it?
Right. And then when you understand that, then you start to have to look at global solutions. Where are the nexus? So, this is one reason why the medical codes interested me, because if you can change the medical codes, they're adopted globally, So there's an opportunity now on a global basis for anyone, anywhere in the world, to get a much better chance that they'll get a diagnosis than they did before.
So tell us about your journey with the World Health Organization. How did that go?
Sure. So first of all, I just want to tell you that I actually wrote a book about the experience, and it details very clearly a lot of the points we've been discussing. It's called Slime: How Medical Codes Mortally Wound Corruption and Scientific Fraud, and it's available on Amazon. The e-reader is only a few dollars, you know.
Yeah.
And it comes with great illustrations done by David Skidmore of Lyme Loonies. So I use a lot of humor to mock these horrible people and institutions that have caused us so much damage, because they are only humans and they need to be cut down to size. But the book details basically the journey that we took to change the codes, and we succeeded in changing the codes. So the ICD-10 codes only had recognition of arthritis due to Lyme, meningitis due to Lyme, and polyneuropathy due to Lyme. And the ICD-11 now has 14 new codes. And they include disseminated Lyme borreliosis, Lyme neuroborreliosis, Lyme carditis, ophthalmic Lyme borreliosis, late cutaneous Lyme borreliosis, other specified disseminated Lyme borreliosis. This is really important because this means you can say, okay, I have a late stage Lyme infection of my kidneys or my liver or whatever organ might be affected. Mm. None of these codes were there before. So we have late other specified disseminated Lyme borreliosis. We have disseminated Lyme borreliosis unspecified for those areas that have not been well documented yet, but are still causing disease and problems. Dementia due to Lyme disease, that's huge. Other specified white matter disorders due to infections, central nervous system Lyme demyelination due to Lyme borreliosis. So all of those neurodegenerative conditions, like the MS, multiple sclerosis type conditions, the Parkinsonianism, the ALS or Lou Gehrig's, all these neurodegenerative now have a code. And if you go there, you can say, okay, I'm having this. Somebody says, well, no, in the past you could get a code for Lyme arthritis. Yeah. But you couldn't get anything for Lyme.
Neurological Lyme, yeah.
Neurological Lyme. So it's a really important breakthrough to have all of these new codes, and they're going to be adopted globally. So the old ICD only had 3 complications recognized. Now we have 14. Out of the new codes, 6 describe infection in the central nervous system. So it really redefines the disease in many ways. It's no longer a disease of arthritis.
Well, it fits the clinical picture, doesn't it?
Yes.
It's not just purely arthritic.
No, but I mean, it really emphasizes the central nervous system. Sure, yeah. 6 out of 14 codes are now emphasizing the central nervous system. Because of this, it kind of underscores that Lyme has an affinity for the immune privileged sites of the body. Okay. So it reinforces a lot of the science that we've been discussing. It also recognizes a number of conditions that are life-threatening. So again, it's a much more accurate portrayal of the illness. This is not a minor nuisance disease. This is a life-threatening disease. Yeah. Dementia can kill you. Carditis can kill you. All of these things. So these all have now. So we've been able to redefine on a global scale what Lyme is. So if people know that these new medical codes exist, they're going to get a very different picture of what Lyme disease is. And the other thing that's happening is that, I have been urging Lyme advocates across the globe to use this information when they go to advocate. Because when the World Health Organization recognizes these things and provides these medical codes, they are a very highly reputable organization. And every government in the world has been involved with this process. So it's, you know, it's kind of like saying, you know, okay, it's one thing to try to discount a medical society, but it's very hard to discount the science coming out that supports these new medical codes.
Excellent. So what happened with the congenital one?
Okay, so, well, so we were so excited when congenital Lyme was recognized. In June 2018, they came out with what's called the stable ICD codes, and those were voted on. So there's this, you know, multi-year process to adopt new codes. So in June 2018, they came out with the stable ICD codes, and congenital Lyme was given its own primary code. And this was a major breakthrough because it now recognizes not only tick-borne, but it's actually vertical transmission, interhuman transmission of the illness. And it had a primary code. And when you have a primary code, that means that you will get a tracking on an international scale of the illness with a primary code. Okay. Then December, right before the holidays, literally, I got an alert that the code had been deleted. And when I investigated into it, I found out that the code had been deleted back in October, but they did not announce it until right before the December holidays. So all over the holidays, I was scrambling to globally trying to get advocates to contact their political representatives, to contact the World Health Organization, because the World Health Organization is required to respond to member inquiries. So an advocacy group that's not government cannot expect a response. But if a government official makes a request, they can expect a response. I had a very hard time getting anybody to take action over the holidays. Yeah. Then eventually some people started writing letters. And we had 7 countries writing letters to 8 countries, writing letters to the World Health Organization asking, why was this code deleted? Well, meanwhile, I already knew why the code was deleted. I received an internal email from a senior person on the Medical and Scientific Advisory Board of the ICD codes. And he told me that the Public Health Agency of Canada asked for the code to be removed.
So how could one have such power?
Right. No, it's against the rules. Because these codes affect every country in the world, which is why they have to be done in an open manner. You know, one country cannot just come in and shut down a code. But there's, you know, so I had this email. I couldn't give the name of the person because I didn't want them to get in trouble, but I have the email, and you know, they gave me specific information. It was a Public Health Agency of Canada, and they were like very sorry that nobody knew about it. So the whole thing was hidden and done in such a way. We don't know why, except that they were coming out with a paper to try to basically deny the existence of congenital Lyme, which they later did. But of course, the CDC is a co-author on that paper.
Okay.
But I think the main reason that they went after that code is because they want to try to pretend this is simply a tick-borne disease. And they do not want to deal with, it has huge implications when you start talking about intrahuman transmission. It becomes a whole different level of response as a public health issue.
Absolutely.
And so, you know, as long as you can deny that. So they came up with some very ridiculous excuses as to why the code had been removed. They said, well, it's not a syndrome. Well, there are plenty of congenital infections that are not syndromes, and they still have a code. So they had really no legitimate reason, and the inquiries to the World Health Organization in every case asked, okay, you know, what is the science? What was the science used to deny the code? You know, we already agreed to have the code. The code was already vetted globally, right? It was accepted and voted in globally, and then it was removed. What science overturned that code? We've never gotten a response as to what the science was to deny congenital Lyme.
So the clinical picture is clear for congenital Lyme. What's the recourse for this, Jenna?
Well, right now, I mean, what you can do is you can use a secondary code for congenital Lyme, like you could put in the primary code for Lyme borreliosis, And then you can use a secondary code that says congenital bacterial infection. So you can still code it, but that's different than actually having a primary code that would be like on a nationally notifiable registry. Because primary codes are what are used to track major health issues, and secondary codes are considered descriptives, descriptions. So what can be done is that there has to be, ongoing pressure put on the World Health Organization, one, to respond to this, and these codes are not fixed. The World Health Organization can change a code anytime it wants. They have general procedures where these things happen, time frames and procedures, very, bureaucratic and administrative in that way. But if there is any kind of crisis, they can change a code immediately. For example, they held emergency meetings and gave Ebola a code in 2016 because it became a global pandemic threat. Now, you got to wonder, how did it go, from 1970 something when it was discovered to 2016 without a primary code? It had no primary code. Ebola did not have a code. It was under a general code for hemorrhagic fever. Why? Because it wasn't considered a threat to many people, so they didn't bother to give it a primary code. But when it became possible that it was going to be a pandemic, as it escaped from West Africa to many different parts of the world, then they said we have to have a primary code for Ebola. So these things are partially political, if you know what I mean. Yeah. Ebola has definitely been a recognized serious illness since the 70s, but they didn't give it a primary code until they figured that it was actually more of a global threat.
So somebody has to make noise, basically, for things
to progress. To make noise. You have to make noise. And in the United Nations system, you have to make noise that is, one, multi-country and multi-region. And you have to have government representatives making the noise.
Because so that's why it was so important, Jenna, for you to have gathered all the colleagues from multiple parts of the globe.
Absolutely.
To unite in one voice. I think that's one of the biggest challenges for Lyme advocates globally, is that we're siloed and not working together sometimes.
Yeah. Well, I have the committee that was formed. It was mostly scientists and doctors. There were some patient advocates. They did not, I did not have a large group of patient advocates, partly because we had to work very hard in a very short time frame. And as you know, a lot of patient advocates are struggling with health issues.
Yeah.
And partly because for the legitimacy of the group, it had to be seen as a largely professional, high-powered group. So these are a lot of political decisions, that you take. Yeah. You're trying to do something to influence the UN system. So we had to have multi-regional. So we had representation from Africa, the Pacific Rim, Northern Europe, Eastern Europe, Western Europe, South America, Canada, United States. That's pretty good representation.
Excellent. Was there any legal representation in that group? Or mostly medical and scientific?
Well, I mean, one of the advocates is a lawyer.
Okay.
That's not her area of expertise, is not, medical law, but, we had lawyers. Myself and another person are human rights experts. I mean, I do a lot of work in the legal area and policy area, even though I'm not a trained lawyer. I've written a lot of legislation and changed a lot of legislation. But yeah, you had to, yes.
So we have our first human rights legislation in Australia, in Queensland, actually. It's a state-based initiative, and it is effective in February this year, so next month, which is, I think, an avenue that some patients will want to know about.
Oh, I think it's so important. If you'd like, I can go ahead and start talking about the human rights side of things.
That'd be great. Thank you.
Okay, sure. Okay, so anyway, this is a major accomplishment to have all of these new codes for Lyme disease, because it means that globally you could go in with Lyme carditis and now get a recognition. Its primary code will be assigned. You should be able to get coverage through your national health system and or your insurance policy. And there'll be somebody tracking how many cases of Lyme carditis there is. Same thing with neuroborreliosis. So this is major. It's major. But that doesn't mean that the work has to be protected, and it has to be deepened, because we could only go so far. Not only did we provide the scientific backing, but we lobbied from a political and human rights perspective. We held meetings. We asked for meetings with special rapporteurs at the United Nations that are responsible for health, human rights, and the one for the rights of human rights defenders. And that was very critical as well. And I say that because the human rights defenders are the doctors, the parents, anyone who's trying to protect and provide care for the Lyme patient community. So to get them formally recognized as human rights defenders in the UN system. So that was also provided. So I just wanted to show you quickly, here's a copy of the scientific document that went forward to the Special Rapporteur for Health Human Rights. And then this is a copy of the report that went to the Special Rapporteur for Human Rights Defenders, the situation of human rights defenders. And both of these reports had authors representing multiple regions of the world, high-level professionals, very heavily documented professional reports that went into play.
And if somebody listening wants to access those documents, are they available?
Yeah, I mean, actually, I put them on Amazon, but if people write me an email, I just send them copies. Okay. Yeah, I distribute free copies of those. Okay, so I also wanted to say one of the codes, one of the Lyme conditions that is not in the ICD-11 is there's no code for post-treatment Lyme disease syndrome. There is no code for post-treatment Lyme disease syndrome because it doesn't exist. It's a fabricated condition.
It's a dodge.
It's a dodge. But the good thing is there's no code for it. So you can say, look, there is no code for post-treatment Lyme disease syndrome because it does not exist. And so there's
Jenna,
never been a code for it.
what is the hope in this message for, especially for patients and families and doctors affected by the politicization of this disease? What's the hope?
Well, I think there's a bunch of things. I mean, one, I think that, the fact that we have all these human rights abuses on record, formally on record, the fact that we have new codes that are coming out and being adopted globally, the fact that the World Health Organization now accepts all of these multiple complications from the disease, that's a major, major change. And like I'm saying, advocates have to start using this as leverage when they go in to negotiate and discuss, because they're not talking about an ILADS paper anymore, although I hold great respect for ILADS. But when you say the World Health Organization recognizes these complications, it's a whole different game, because your government has been involved with the World Health Organization development of the codes. They might not have been specifically involved with that code, but they were involved with the development of all the codes, and they were stepping multiple years voting yes, yes, yes. Okay.
And doctors themselves could use that, couldn't it? Because definitely
absolutely.
Doctors in Australia are being vilified, the ones that stand
absolutely. Up. Absolutely. Yeah, so what I wanted to say on the human rights, so it was very important to document the human rights abusers, human rights abuse not only against the patient community, but also against the human rights defenders, because doctors are in a situation where they can lose their license for simply providing treatments that meet internationally validated standards for care. There's no other disease where you can automatically lose your license can be threatened because you are treating according to internationally validated standards of care. That makes Lyme very unique, But anyway, so I went through and I did the section, but it's very, very tabulated, very detailed, all of the human rights abuses and where they are. And then I gave specific examples of all of them as well. But there are 11 human rights treaties in violation. They include the African Charter on Human and People's Rights, the Convention Against Torture, the European Convention for the Prevention of Torture and Inhumane or Degrading Treatment or Punishment, the Convention on the Elimination of All Forms of Discrimination Against Women, Convention on the Rights of the Child, Convention on the Rights of Persons with Disabilities, the European Convention on the Protection of Human Rights and Fundamental Freedoms, the European Social Charter, the International Covenant on Civil and Political Rights, the International Covenant on Economic, Social, and Cultural Rights, Article 12, that states steps for the realization to health include reduction of infant mortality, healthy development of the child, prevent, treat, and control epidemics, create conditions to ensure access to health for all, and then the International Convention on the Elimination of All Forms of Racial Discrimination. So these are all the international treaties that are in violation. And there are 31 human rights articles, of which 14 are in violation across these treaties. 14 out of 31.
Wow.
So they include, number one is the right to the highest attainable standard of health, the right to freedom from torture, cruel and inhumane and degrading treatment. If you'd like, I'll give examples of these. But
I'm flashing back to some degrading treatment I've experienced.
Yeah. Well, I mean, it's actually a human rights violation. If your access to the highest attainable standard of health is being interfered with, that's already a human rights violation. And
well,
then
to quote Dr. Horowitz a couple of weeks ago, he said that both IDSA and ELAD's treatment guidelines are evidence-based, and medical doctors have the right to choose which one they would like to utilize.
Mm-hmm. Okay, just again, for an example, a right to freedom from torture, cruel, inhuman, and degrading treatment is that state policies restricting antibiotic access for Lyme and Lyme-like illnesses cause patients to suffer unnecessary pain, disability, bankruptcy, and even death.
So sorry to everybody, this is sad news.
I mean, I'm laughing, but it's just so over the top to think of that. It's here's another human right that is in violation: the right to life. Yeah. We have a right to life. Outdated and politicized state Lyme policies result in disability, bankruptcy, and suicide for many Lyme patients. Death and suicide. Right to liberty and security of persons. When people are forced into psychiatric care, that violates their liberty and security. Forced into psychiatric care instead of medical care for infection. You can have psychiatric care for the psychiatric complications from the illness, but in lieu of infection, treating the infection, then you are now, in violation.
Absolutely. Yeah. Right
to privacy and confidentiality. Medical records is shared without Lyme patient consent. State, every time a doctor is investigated, they turn over all the patient records. That's a breach of your confidentiality.
Yeah, that's happening all around Australia.
It's all over, and it's against human rights. The right to information. When a state policy, government policy, fails to inform you that there is a risk of disability and death from lack of treatment, they're denying right to bodily integrity. Right to participation in public policy. So we have two forms in which that happens. In some cases, doctors who are under restriction are not allowed to go and give presentations or cross state lines to attend conferences. The other one is that we have public policy, which is empty theater. It's a joke. You have all of for example, the Tick-Borne Disease Working Group is going to have a meeting in January. It's a 2-day meeting. There is 30 minutes set aside on each day for the public to make comments. The public comments have to be submitted in advance. No one's allowed to just come in and speak their mind. It has to be vetted, and you're given 3 minutes, and there's no requirement for any response.
Mm-hmm.
Now, I have participated in 4 federal advisory committees. There's no reason for this procedure to take place that way. We often would have open meetings where people just came in and asked questions to the Federal Advisory Committee, and we were expected to respond to these questions. This is a completely scripted and contained, quote unquote, public engagement. So if somebody submits public comments they don't want to hear, they're not going to be chosen to speak. You know, and again, they can say people may allow some more critical comments to be made, but there's no requirement for any response whatsoever. So it's a falsification of the spirit of public engagement. That's not how it's supposed to be done. And of course, the Canadian situation is you know, I have been in many conversations with the Canadians on what they went through, and they had all of this back and forth and all the adoption of the new language, and then it was all deleted out, and the publication went forward with no representation of their input. So similar things have happened in the U.S. in the Federal Advisory Committee, the Tick-Borne Disease Federal Group, and partly it's the, you know, again, I've been on 4 different federal advisory committees. Typically, when you have a federal advisory committee, you have 1 or 2 federal employees, and the rest are advisors to the federal government. So the majority are outside constituents, experts, et cetera, who are representing the interests, and these are federal advisory committees. They're advising the government. You do not have a situation where majority of people are representing the government. You already have those kinds of groups internally, where you have, you know, multi-agency government meetings and committees. So the whole, you know, when you talk about public policy, you can have what looks like a public policy engagement, but it's been so contorted that in fact it's just theater, you know. So when these situations fail, you have to go around. You have to go to media. You have to go to elected officials. You have to, like, you know, as others have said, you need to bring public pressure to bear from other avenues, not these you know, empty theater types of gestures that have been happening. Okay, another right is right to non-discrimination and equality. You know, basically, policymakers and medical practitioners and hospitals have been encouraged to claim that Lyme patients are psychosomatic as opposed to having a real illness. As a form of discrimination, clearly, resulting in the obstruction to medical care for infection and its complications. Right to decent working conditions, where people who work in the field to help Lyme patients are routinely defamed, harassed, and threatened by state actors and medical boards who belong to a competing private medical society. Right to freedom of association, the right to science. So this is very interesting. Article 27 is right freely to participate in and to share in scientific advancement and its benefits. The right to the protection of the moral and material interests resulting from any scientific, literary, or artistic production. Well, I mean, how many times have efforts made and articles made have been shut down, you know, by these views? And the fact that people are being blocked from participating in and benefiting from scientific advancement. You know, the games that are played around the diagnostic tests are an example.
Yeah.
You know, there has been every effort made over multiple decades to block more sensitive testing and to defame better tests, more sensitive tests.
That's definitely happening in Australia.
I mean, in 2001, there was Inspector General report. The Inspector General in the U.S. is responsible for like investigating federal agencies, and the Inspector General did an investigation into Lyme disease, and they asked the NIH and the CDC a number of hard questions because there were already a lot of outcry as to what was not being done. And at that time, they said, we have a direct detection test, like a PCR test, that would look for, you know, the RNA and the DNA of the organism in the blood. and it's ready to roll out. That was 2001.
Mm.
And then they shelved it. Because they don't want to have, the epidemic recognized. But anyway, so that's strong. Okay, right to due process, and that's when practitioners are, attacked. When parents' children are taken away, claim Munchausen by proxy, and the gymnastics they have to go through to get their children back. Their right to due process. It's a situation in that, and particularly with the Munchausen by proxy, they're basically guilty until they can prove their innocence, which runs in direct contradiction to legal practices in most cases. So, in terms of and then a right to a remedy, that we've been denied a right to the remedy because the state takes no action to address any of the violations that have been described. Like I said, it's just kind of a lot of stalling and promotion of status quo. So when we talk about Australia, and it's the only country to deny, its endemic thing, well, I think what you have in Australia is what you have elsewhere. It's just a more concentrated form of denial. They've basically, the strategy that's used globally is the same strategy that was used by Big Tobacco to deny the effects of tobacco on public health. So I don't know all the specific particulars in Australia why they want to deny that it's endemic, but I'm sure, it's all about money. So to find out, we know specifically who denied the illness in the United States. We know which insurance companies headed, that whole charge to deny chronic Lyme. We know specifically who of the medical and scientific community was complicit in denying the chronic nature and the severity of the illness. We actually have the names, we know where the bodies are buried, right? I don't know all the circumstances in Australia. But, what I do have to say is that whatever happens on a global scale can be replicated anywhere. So in terms of what's hopeful is that the EU, the European Union, passed a huge resolution, which means 28 countries unanimously passed a resolution on Lyme disease that acknowledges that the whistleblowers have been denied. The validity of the whistleblowers have been denied. The chronicity of the epidemic of the disease has to be dealt with. That the patient population has been marginalized, that the tests are insufficient or of poor quality. So that's huge. That's huge.
Massive. Yeah.
That's massive. And it passed unanimously. So despite all these efforts to deny the epidemic, there are so many people speaking to their elected representatives that this happened. Okay, that's a major, major change. Then the other thing I think that's really important is that there have been multiple lawsuits that have won. For example, there was a lawsuit in Norway against the laboratory that claimed you don't have Lyme disease because you tested negative. They lost the lawsuit, and that person's been awarded. Similar lawsuits in France, where they sued the laboratory for falsifying the validity of the test. So I think lawsuits are a very, very important tool. The other lawsuit that I think is so important is the one that was coming out of Texas, where it named the Infectious Disease Society of America, Blue Cross and Blue Shield, Anthem, Blue Cross and Blue Shield of Texas, Aetna, Cigna Corporation, Kaiser, United Healthcare Services, and United Health. And Kaiser has settled with them already. And that's really, really big.
Goosebumps.
Yeah.
That's the start of a movement, that is.
That is. And again, it's because they did due diligence. They did a great job putting together the lawsuit. But this is what we need to do. I mean, we need to hit them where it hurts. You know, we clearly just providing information is not
Science doesn't
working.
No.
No, we have to go after them for the human rights abuses. We have to go after them for fraud. You know, we have to go after them for racketeering. We have to go after them for all of these things that they've been doing. We have to name it and go after it. And it requires organizing on these things. And I mean, and then of course, the individuals who are named in it include Gary Wormser, Eugene Shapiro, Robert Nadelman, Alan Steer, Raymond Datweiler, John Halperin, and Leonard Siegel. Now I'm going to return to the Tick-Borne Disease Working Group issue. Eugene Shapiro is on the Tick-Borne Disease Working Group. Yes, there's been a request to remove him, but it's been ignored. That speaks volumes as to where the US government is on this. Why would they allow somebody who has been documented to deny care for children with Lyme disease, who's named in a federal lawsuit, who has personally responsible for injuring numerous multitudes of families, and they allow him to be representative on this Tick-Borne Disease Working Group?
That's not dissimilar to Australian experience, I can affirm.
Yeah, but I mean, it shows a real lack of willingness on the part of the government to even hear the Lyme patient community, because they could have another pediatric, specialist in there. It doesn't have to be Eugene Shapiro. It doesn't have to be him. So, but anyway, these people are all going down because if Kaiser settled, the same facts stand in all the cases. The same facts stand in all the cases. So
that's good news. Once we get some of these global precedents, they can follow. So, if you're listening today and your situation is pretty rough, make sure you we say this all the time at the LDA, keep really good records, keep track of your conversations, keep track of exactly get permission to record medical appointments, and keep your documents, and get help if you can't. Ask, be humble and just ask for help, because I know, myself included, I lost that analytical organizational side of my brain. I didn't even know my family's names at one point. So my medical files are in tatters, but this is 18 years down the track for me, and I can recommend for those of you who can get your files in order, there's going to be justice served for you.
Yes, there will be. And I think because Australia has a Human Rights Commission, I think you guys need to exploit that. I think you need to approach the Human Rights Commission and make it about human rights as well. Because I know part of the complication in Australia is that you have strains that may not be Lyme, the Burgdorferi strain. That doesn't mean you don't have pathogenic strains that are recognized pathogenic strains of the illness.
We actually have both.
Yeah.
Plus, we'll probably have unique ones. We've got unique everything else here.
Yes, exactly. Yeah. But I know that when we approached the World Health Organization to try to change the codes, they tried to blow us off. But when we had the documentation of the human rights abuses, they had to listen, because we were able to broaden the audience. And tactically, this is what you have to consider when you are trying to advocate for change on gross human rights violations. You have to bring in as many different types of constituents as possible. So to just kind of batter your head against the science and medical community is not enough. You have to bring in the human rights component. You need to bring in, for example, unions, like union workers, like to give you an example, in France, one of the reasons that France has been able to move ahead on its advocacy front and to gain traction and developed a very good national tick-borne disease plan, even though I know people aren't happy with the entire thing, but certainly is the best document. It's the best national plan that we have to date. It's far superior to the US one, far superior. And one of the reasons that they gain traction is because the logging, the timber community in France and farming communities and everything else. You know, they were, yeah, they were, you know, saying something has to be done. And another interesting issue point in France is that you have golfers who represent, you know, the more well-to-do class in France, golfers, and they're all being struck with this illness. So now you're having, you know, the wealthier, more influential people. You have the working communities, this and that. But I'm saying, so you're bringing in these constituents.
The voice, isn't it? Yeah.
Yeah, yeah, and I think speaking to human rights is very critical, because when there is evidence of, when there is controversy over an illness, for example, we don't know what causes these chronic conditions, complications. Could it be, you know, a simple sequela? Is it active infection? We don't agree. We're not sure. But the fact is, if there are open questions, ethically, you are still required to treat.
Yeah.
That, I mean, that's a given. Medical ethics says you are required to treat if there are open questions on this, you know. And one of the questions you said, who do we turn to have these things happen? Well, I would agree. You know, you have to organize politically. You have to bring pressure on the government's representatives, on the insurance. But I think one of the most strategic things to do is to go to the Human Rights Commission with cases and to take lawsuits. You know, lawsuits are really, really important tools. I mean, I don't know enough about the Australian legal system, but I know in the United States, you know, these big financial interests, they don't pay attention until it starts costing them money.
Yeah.
I mean, definitely. So it's a very, very important tool, you know, to
get those first case precedents down.
Yeah. And like in the case, I was speaking earlier about a friend of mine, who we've become good friends. So, and I can speak to her case, but you know, she has been on and off disabled by chronic Lyme disease. Her name is Jane Fuhrer, and she works for NBC Universal. And, you know, they tried to kind of get, you know, pressure to get her to just leave her job, you know, to leave instead of providing her accommodations for her disability. But we have documented everything. And so, you know, they can't.
That'll help the next person.
Yeah. Well, they can't just get rid of her, you know, even though there was, and she couldn't have done it by herself because she's sick.
Yeah. Yeah.
You know, so, you know, you need help getting this kind of documentation, maintaining it, knowing what to do next. You know, when you get faced with for example, you know, you're missing too much work kind of accusation. Well, you know, you have a medical condition, you have a right to miss work to seek medical care, you know, or to be ill. You have a right to, you know, to be at home resting if you're very sick. So, you know, to document all these things is very, very important.
And so, Jenna, what's in your heart to leave people with today? So the people out there who possibly are sick, or the family of someone sick, or the doctors who are all doing it so tough in Australia, what would you like to leave them with today?
Well, the first thing I want you to think of is consider you are not victims here. You have been victimized, but you are not a victim. You are persons with your own agency. You have the power to make changes in your life. You have the power to organize, to make change. You are human rights defenders. You are defending your own rights to care. You are defending the rights of others to care. The doctors are defending your rights to care. You are a powerful group of people. Consider yourself as a human rights defender, number one. Number two, remember that you have lived with and dealt with an extremely devastating illness, and you're still here. And you're still here in the ways that matter for your friends and your family and for your larger community. So you're a very powerful person in that way as well. And to remember these things, particularly on the days you're not feeling good. But the third thing I want you to consider is that, you know, we have to be very strategic in the way we fight these predators, and that's what they are. These are people who are predators to your money and to your life essence. They are basically trying to take these things away from you. They are trying to tell you that you have no right to care, and you have no right to life, really. Mm-hmm. So we have to be very tactical in the way we organize against them, and to also recognize them for who they are. Don't be fooled. When somebody says we are studying the matter, we are looking into it, usually that means it's a delaying tactic. There's no interest in doing anything about it. Every country in the world should basically have a rule that says Lyme patients should be treated according to their symptoms. There should be no other medical restrictions on their care. We know it's a multi-systemic, chronic, relapsing, and remitting illness, and it requires that kind of care. And it used to be treated like that. Yeah. And you have a right to that care. You have a right, and every nation in the world should be supporting that right to care. So I think that's what I'd like to leave people with, that you're powerful, you're tenacious, you're resilient, and you're worthy.
Jenna, thank you so very much. I know that this will benefit multiple levels of our situation in Australia, and I know that there'll be human rights defenders out there that will take this and run with it, and hopefully we can do that together. So thank you very much for being here with Australia.
Okay, you're welcome.